This man, only identified as Okello and his wife Esther, are peasant farmers in Kakoge village, Bukhabooli sub-county, Mayuge district. Okello is blind, so his wife has to fully fend for the family. But Esther is also partially blind. She struggles to keep her eyes open. Before the blindness, the couple fended for themselves by tilling the land. The two represent the eye problem in this community.
Gime Ramani ka wongo karama kakte tuwe wangani wangabero ka neno.
Trachoma is the leading cause of preventable blindness in the developing world. It's also known as the disease of poverty, as it affects people in poor communities, typically living in poor sanitary conditions, with inadequate water supply and a generally poor socio-economic status.
Namusindikanga kukwisomero aye amaiso gamala gamulemesa okolaki okusoma yaira nga amaiso gakulukutanga bukulukuta amaziga aye nga amaziga ago gali oti masando nga gesigasiga ku maiso.
In trachoma, unlike other eye diseases, the eyelashes fall off or sometimes falls in. A close look at this woman's eyes reveals marks of a disease that could steadily eat away the community if left untreated. Mayuge is among the 24 trachoma-afflicted districts in Uganda, but the prevalence has reduced considerably. From 14% in 2007, it currently stands at 3%. But ignorance about the disease could see a spike in its spread.
Atidi oba kiva kuki kitegeera oba bulwaire ki oba bulwaire kinzitidi wabula mbonerawo ng'abaana bakolaki bali kulwala obulwaire obwo.
Namutwala ku mwidwaliro abasawo bankoba ati gye omunaazenga kunaamaadi amainogovu bampa kunaakalezike namutoniangaku aye tibyakola.
In Bukhabooli sub-county, 11 villages are affected. This family has 4 children with trachoma, and since it's spread by the housefly, the rate of spread could be faster.
Bwida mulundi mulala omulala kati walwala bona nga bubagema mulundi mulala.
It's actions like this, wiping dirty clothing in these eyes, that causes more harm, just like the signs and symptoms of trachoma include mild itching and irritation of the eyes and eyelids, discharge from the eyes containing mucus or pus, swelling of the eyelid, sensitivity to light or photophobia, pain in the eyes. Many here opt to use local herbs to treat a disease they know very little about. Village health teams, or VHTCs, regularly supply antibiotics in Greater Mayuge, but they rarely come to Bukhabooli since it's a hard-to-reach area.
Singa Katonda batuyambye ne batugemeraku ndowooza ti ninze zenka alina obulwaire buno tulire balwaire bangi aye olw'okuba eno mu kyalo tuba tuzira buyambi bwona bwe tufuna.
Landing sites, the people in the forest and other mountainous areas, because we have a lot of hills in Mayuge. So for us we have the supplies, and we are not facilitated really to go out looking for such people.
Proximity to Lake Victoria has also been cited for the prevalence of the disease here.
Someone who is infected with cholera goes and defecates in public water, where people use that water, where many people use that water. They are unable to boil the water, they drink, they wash hands while they are going to eat.
The health officers say a lot has been done, but blame the negligence and reluctance of the people to test for the disease and attend free eye clinics.
Patients are also hard to understand. When such a project has come and they are holding a camp, many will turn out and they will be screened. Those with complications will be booked for surgery. But when the day for surgery comes, they will not turn up.
And yet the locals blame the health workers for not doing enough sensitization and ensuring that there are drugs in some health center falls.
We do have the drugs. Let them come, consume, finish, then we say yes, there is a stock out.
The other affected regions include Karamoja, Busoga, Bunyoro, Lango, Achole and West Nile. In the eastern region, trachoma is most prevalent in Mayuge, Iganga, Bujiri, Namayingo, Namutumba, Luka and Palisa. Late treatment may lead to their conditions in advanced stages, and so it appears the elderly man may never regain his sight. Sheila, NTV, Mayuge district.